2CB was chemically made in the 1970s, originally for psychotherapeutic use. However, the individuals who were using this drug were shown to produce significant GI disturbances, with an apparent decrease in empathetic behavior. Due to the development of these disturbances, 2CB was then primarily used as an aphrodisiac in relation to the nightclub and music festival scene. Young adults who partake in these environments take this drug as a substitute for the more popular partying drugs such as LSD or ecstasy. Based on a global drug survey completed in 2013, out of the 2,282 respondents who completed the questionnaire, 46.4% of them reported a lifetime use of at least one NPS. In other words, the use of what are called NPS, or new psychoactive substances, are relatively popular in our world, which makes it all the more reason to become intelligent on the pharmacodynamics and kinetics of this drug in relation to our physical and mental health. Currently, 2CB is listed as a Schedule II drug within the 1971 United Nations Convention on Psychotropic Substances panel. This drug belongs to the 2C phenylalanine drug class, which have all the same chemical backbone in common. Structurally, 2CB is similar to the amphetamines and mescaline. However, there have been concerns raised against various scientists that have to deal with the lack of information surrounding pharmacokinetics of this drug, which make it difficult to study therapeutic effects in humans and to engage in further research. However, a study done by Papasit et al. Recruited 16 healthy and experienced drug users to participate in an oral administration at 10, 15, or 20 milligrams of the 2CB drug. Results from this study concluded the lower doses to have increased blood pressure and heart rates. Psychedelic effects produced increased levels of euphoria, changes in perception in relation to shape, color, and lights, and differing body sensations, including heightened senses. 5 of the 16 subjects reported having mild hallucinogenic effects. In general, the results coming from the human participants in these controlled trials were very similar to the effects produced in the trials done with rats, as seen in Rahanova et al.'s experimental study. Such results included symptomatic experiences of a combination between hallucinogenic properties coming from drugs similar to mescaline, along with stimulating properties coming from drugs similar to the amphetamines. Other studies of pharmacokinetics have concluded 2CB's clinical effects as being similar to MDMA and the amphetamines, and being structurally similar to mescaline as well. Typically, this drug is taken as a pill orally, or it can be crushed up and administered through nasal inhalation. A mild dose consists of 4 to less than 10 milligrams, while a moderate dose consists of 10 to 20 milligrams, and a high dose consists of more than 20 milligrams. With mild dosages, hallucinogenic effects, including euphoria and increased sensations, along with increased stimulating effects, were reported. Mild doses produce the same effects, along with increased visual hallucinations, with intense color play and distortion of shapes and objects. Higher doses consist of all of the above sensations, but with an increased hallucinogenic effect. Risk of hypertension and hyperthermia, along with related toxicities, are also increased with higher doses. Although 2CB has a high potential for abuse, many users perceive this drug as being relatively safe. According to Nutgeren van Logenhuizen et al., there is a perception among 40% of users that this drug only produces a medium to low health risk. That being said, there are no known cases of drug-related deaths in various hospitalization settings because we don't have the proper technology to be able to detect active or inactive metabolites in the samples following intoxication. To this day, there have only been 3 reported cases of toxicity surrounding 2CB. The first case was involving a 43-year-old woman who developed cerebral vasculopathy with neurological deficits. In other words, this woman experienced a rare case of a stroke with induced neurological deficits that were not specified. However, the detection of TCB was not found following extensive tests on this woman. The same lack of detection occurred in the second case, which involved a young man, age is not specified, who developed drug-induced psychosis following a one-time consumption of the 2CB drug. In both cases, the patients were able to survive and get treatment. However, their quality of life was certainly lacking due to their decision to consume this 2CB chemical. Lastly, the third reported 2CB intoxication case was involving a 19-year-old male who became unresponsive following consumption of the drug, which resulted in his development of seizures. The presence of 2CB and no other drugs were detected in this patient. However, the patient ended up, fortunately, surviving his toxicity. Other symptoms he developed from this intoxication included lactic acidosis, which is lactic acid buildup in the bloodstream, rhambulomosis, which is breakdown of muscle tissue, sinus tachycardia, which is irregular heart rate, followed by slight movements and/or stress, flushed skin, diaphoresis, which is excessive sweating, clenched jaw, rigid extremities, and myodrisis, which is pupil dilation. And although we have limited information on the pharmacokinetics of 2CB, we do know that the drug can be detected in oral fluids for up to 16 to 24 hours after administration. Because of this, it should be very important for our world to enhance our modern technology to be able to fully detect these drugs in order to indulge in further studies surrounding the psychological effects and treatment surrounding abuse and potential treatment for psychobehavioral outcomes. Pro-social psychobehavioral outcomes, that is. Because if we did this, we would be able to better understand the cause of death and treatment relating to drug-induced toxicities that have been reported to create hospitalization. And in relation to metabolism, the enzymes monoamine oxidase and cytochrome P450 have been detected to play a role in the breakdown of 2CB. Following excretion of this drug, 2CB have been detected in the tissues surrounding the brain and lungs, along with other various structures. The latter provides with a great basis in where to go for further research. However, these results have been done in following studies in rat trials and have not yet been proven to be the case in human experiences. So for this reason, the pharmacokinetics of 2CB in human participants have not been fully explored. Moreover, the dynamics of 2CB have demonstrated an increase of neurotransmitters in the brain, especially the ones inducing our reward system, such as dopamine, serotonin, and norepinephrine. That being said, we can account for this drug to have a high potential in abuse, as demonstrated in the Schedule II classifications. Dopamine acts as an antagonist against MAO enzymes, while 2CB in itself acts as an antagonist against reuptake transporters towards serotonin norepinephrine levels. In turn, this produces more serotonin and norepinephrine levels in the brain. While on a receptor level, 2CB clearly activates the serotonergic 5-HT2C and A1 adrenoreceptors, which creates stimulating and hallucinogenic effects, and also induces our reward system and thus addiction potential. In terms of potency, 2CB is about 15 times more potent than mescaline, which is very interesting because mescaline has a similar structure to 2CB. Some users reported unpleasant effects after taking this drug, which include difficulty concentrating, trembling, sweating, insomnia, and flashbacks are more likely to occur after this drug for up to 48 hours after exposure. A combination of 2CB with other substances have been linked to cause excited delirium syndrome, and this syndrome produces drug-induced delirium combined with agitation and aggression, along with hyperthermia in many instances. So if not professionally treated, patients may eventually experience cardiopulmonary arrest and die as a result. Users who partake in this drug experience should not only be wary of their dosage, but they should also be informed on the psychopathic results that may occur after only one use of the drug. Intelligence surrounding this concern may be enhanced if we have the proper medical technology in order to detect such pharmacokinetics and to thus investigate further treatment options.